Hey everybody, this is Todd, the Director of Content at Beyond Type 1. I'm here again today with Dr. Ann Peters. We spoke to her a couple weeks ago, answering some of the community questions about coronavirus and diabetes, and she's joined us again today. We have another list of questions for her, and yeah, I think we're just about ready to dive in. Ann, can you please quickly reintroduce yourself to the audience?
Yes, hi everybody. I'm Ann Peters. I'm a diabetologist at the University of Southern California in Los Angeles.
Great. Thanks, Ann. So I'm going to dive right in here. One question that we got recently, and I think this question kind of goes beyond just coronavirus, is people are wondering what treatment is like for someone who has it with diabetes, what treatment in the hospital would be like. And so my broader question also is, when you're admitted to the hospital with diabetes, what is treatment like in general? Like if you have a pump, do they always take you off the pump? Would it be different with coronavirus? I guess how do they manage your diabetes treatment when you're in a hospital in general, and also if you were to be admitted with coronavirus?
So I'm going to answer this in steps because, first of all, in my patients with type 1 diabetes, I have not seen a single case of COVID-19. And I think my personal belief is that my patients with diabetes are extra aware of health. And I have amazing patients. I probably said this before, but they've taken really good care of themselves. But I have heard about other patients around the country with type 1 diabetes who've been admitted, some with COVID-19, but others with ketoacidosis that didn't happen because of COVID-19, just because they went into ketoacidosis. And therein is the problem, which I'll explain. So first of all, when anybody is admitted to the hospital with type 1 diabetes, if it's elective, obviously you want to discuss this in advance, but if it's an emergency, some places will allow patients to monitor themselves and use their own insulin and use their pumps and everything else. And what's recommended is that at least somebody on the staff of that hospital have some clue about managing technology. So a lot of the time we get questions, your patient's here, they're on a pump, what can we do? And I tell the doctor just to write an order to let the patient manage it. But some places aren't going to let patients do that, or if you're in a coma or something, then the physicians are going to manage it with an insulin drip. But I tell patients that they should be prepared if they go into the hospital to manage their diabetes themselves as much as the hospital policies will allow them to. One of my caveats, though, with the COVID-19 problem is that you're not necessarily allowed visitors because they're keeping everybody out of the hospital. And so there have been times when patients needed new infusion sets or other things where family members brought them. So now what I tell people is have a kit of your own, that if you went to the hospital would have everything you needed to manage your diabetes if you were in the hospital. So infusion sets or sensors, strips, and lancets, just to have your own supplies, because ideally you'll be able to manage your diabetes in the hospital and you will probably know better than anybody. But you're not going to have somebody be able to bring your charger, for instance, for your iPhone that you may need. So just make sure you're very focused on being prepared. And what's been happening in the hospitals is when people have gone into ketoacidosis, first of all, people have waited too long. So normally if people are dehydrated and really can't keep fluids down, they may go to the emergency department sooner. And nowadays people are waiting because they don't want to go, but then they end up really sick by the time they go to the emergency department. So prevention's everything. Everyone should have the ability to test ketones, something so that they don't vomit, and the ability to have fluids at home, sugary fluids, non-sugary fluids, keep them out of the hospital. But if you're too sick to drink fluids and give insulin at home, you've got to go early, because then you'll get even sicker. But the problem, though, is that once you're admitted, in typical protocols for people with type 1 diabetes, your blood sugar is checked by the hospital, by the nurses every hour, and then they're going to adjust an insulin drip. Well, we can't do that now because nurses can't keep going into your room every hour because they have to use personal protective equipment, PPE. And we don't have enough of that for nurses to take it on and put it off. So we're finding a real problem in monitoring patients with type 1 diabetes in the hospital. And whether or not you have COVID-19, that's a problem. So we're trying to ask the FDA to allow us to use Dexcoms, because that way it could actually transmit to the nursing station so someone wouldn't have to keep coming into your room. But that's why I tell patients, bring the capacity to monitor your own sugars to the hospital, because that's the one thing that requires somebody to come in. And normally we don't think about it, a nurse just comes in, but now they can't. So I just say be prepared, particularly to monitor, and do your best to not have to go into the hospital. And like I said, my patients are doing so beautifully at home. I've never seen their diabetes managed better because they're not going out, they're just staying around. But even in my East LA patients, my underserved patients, we're not seeing an increase in our type 1s going into the hospital for DKA COVID-19. So right now, at least in Los Angeles, I think my type 1 population is doing remarkably well. So I'm an optimist always. So it's a good thing because, like I said, people are paying more attention. They can. So why not?
Yeah, absolutely. I did want to ask, we did get some questions about people who, before this whole thing started, were already in the process of switching to a new therapy, like they had ordered a new pump or they were going from pump to MDI or vice versa. Do you have any suggestions on people who maybe were already in the process or were thinking about switching to a new therapy? Would this be a bad time to switch? Or if they already had it underway, could they continue as planned?
Well, so it's done on a case-by-case basis, if you ask me. So, I'm working really hard with my patients to keep them healthy. And I've had some patients who wanted to switch to a pump, who have the pump, they're ready to go. But I haven't felt that I had the personal bandwidth to give them the attention that they need to make them safe. And so I've said, wait. Also because my primary diabetes educator got sick and she's been out. But now that she's come back, I'm able to do it again. So I feel like it's all about safety. And it's a good time, I think, to switch because you've got time. But if you can't do it safely, then don't do it on your own. But you need to have somebody there with you. But if you have a diabetes educator who can be there with you and make sure it goes well, then it's fine. But don't do anything that rocks the boat too wildly. So for instance, the big concern is people with type 1 who are on SGLT2 inhibitors. And I certainly wouldn't start one now, and maybe people would be better off not on them because they increase the risk for DKA. So if people are well controlled on it and they know to stop it if they get sick, it's great, but don't do anything to increase the risk of ketoacidosis.
Great, thank you. I wanted to ask, you mentioned PPE earlier, and I think initially when this happened, the World Health Organization and CDC were saying there's no need for healthy people who think they're healthy, to wear masks out in public. And increasingly, we're seeing a lot of people advocating for widespread mask use amongst everybody, whether or not you're healthy. Do you have any kind of opinion on that? I think the CDC is re-examining their guidance now, but I was just curious what your thoughts are on like masks for everybody.
So I actually kind of think it's a good thing. And let me just point out why. So first of all, N95 masks, which are the masks that healthcare providers use, are very specifically designed to protect us, healthcare providers, from getting sick from someone else. And you have to be trained on how to wear them correctly. They have to fit. You can't have a beard and have them work, right? So yeah, I'm not so sure you could wear one. But you don't want the germs getting in. So N95 masks should be reserved for healthcare providers. But the regular surgical masks are meant to prevent you getting something from me. And if you think about it, if we don't know the carriers of this, and we know that there's at least a quarter of the people who could give it to you who don't know it, if everybody's wearing a mask, you'd way cut down on transmission because people wouldn't be, if they coughed or sneezed, it wouldn't go to you. And then there is some data that it protects you from the big droplets of these coughing and sneezing. And finally, I think it reminds you that we're having a problem. I mean, this is something that we need to be aware of. It also should make you touch your face less. It's very important not to touch your face. Sometimes masks make people touch their face more, and don't do that. But the other thing is then I see people wearing the mask with their nose out. That's like the stupidest thing I ever saw. Just if you're going to have a mask, wear it correctly, But I think masks, for a variety of reasons, are a good thing because I think they'll reduce the transmission of the virus in the population. We don't know this for sure. But I also think that they might help you not get it for a variety of reasons. Not as good as N95, but again, those are only for healthcare providers.
Great, thank you. We did have another question from someone who is pregnant and has type 1 diabetes right now, but I'm wondering about any type of pregnancy and diabetes, whether it's type 2 or gestational or type 1. Are there any extra precautions people who are pregnant with diabetes should be taking?
The answer is not extra special precautions compared to anybody else. So the data increasingly says if you have diabetes, your risk of getting COVID-19 is not increased. But if you get diabetes and you're sick in the hospital, then you may have worse outcomes. And in pregnancy in particular, it's a really scary time, but the data from the Chinese series shows that the babies didn't have a problem, and even with moms who had COVID-19. And you just, again, want to try to not get it, but the outcomes, it shouldn't, we don't know for sure, but the outcomes we've seen in pregnancy haven't shown a problem in the babies or the moms. I mean, it's been okay. One of the issues, though, is all about the fact that often you can't have your partner with you in the hospital. So you may have to deliver the baby by yourself. But at this particular point, having a healthy mom and a healthy baby is the most important thing here. So it may not be the delivery one plans, but that's okay. Just have a healthy baby, just go home with the baby, And also, everybody with type 1 or type 2 in pregnancy needs to be in contact with their healthcare team. I mean, they need to reach out to us. You still need insulin dosage. It's still pregnancy and diabetes. So we're here, that's our role. So I wouldn't be extra worried, but it's hard not to be. But what we know of from the data is the babies will be fine and the moms will be fine, even if the mom gets COVID-19. So just try not to, but it's going to be okay.
That is reassuring. Thank you. I did want to ask you about, you mentioned a little earlier the work that you do with the underserved communities, and we did have some questions about what additional resources or resources might be available for them. Not everybody has access to internet or smartphones for telehealth, and I'm kind of wondering if you have any advice for people who might not either be able to access telehealth or people who are losing their jobs. Like, is there anything additional we can get out there to the underserved or low income or recently unemployed communities who are living with diabetes?
Well, yes, there are all sorts of resources. The ADA, everybody has, helping people with lack of access, but in my world with people who are underserved, they don't have access to computers necessarily or smartphones, so they may not access that. But I do know that our county healthcare system is really working to make the medications available. And at least in California, we're trying to make sure that people who have chronic conditions and lose their jobs or whatever else have some capacity to get healthcare. I work in the County of Los Angeles part of the time, and I still go to clinic there because I have to, because my patients with type 1 don't have the ability to telemedicine there. So I go and see patients, and everybody on my other practice where they have the capacity to telemedicine, I do telemedicine. But I think the operative point is those of us who work in the county healthcare systems are aware of the vulnerability of our patients, and we're still open. So, at least in this state, we're making a real effort to provide care, and people should go, look at their local health department to see which clinics are open, and just go. I mean, it's okay, we're here. So that's our point is, we have resources to help people, but they're not going to be accessing the information online the way other people might.
Thank you. So this one of the last questions is kind of a big one. I'm looking at it now. I don't think you'll have maybe an exact answer, but I would love to get your insight. We are getting questions along the lines of like, how will we know when it's safe to go back to normal? Is it kind of when the government lifts the shelter in place? Is it not until there's a vaccine? I think there's some concern about, especially people with diabetes who feel like, maybe they need to be more careful with their health. It's like, what does it look like to go back to, or when will we know that it's kind of safe to resume life as we were living it beforehand?
Well, I have many, many answers to that question. But let me start with the beginning, is that a lot of people with diabetes don't do the one thing that they could have done to prevent sickness before, which is to get a flu shot. So everybody every year is at risk for the flu, and we go wandering around, and people do and don't get the flu shot. But people aren't freaked out about it. People are freaked out about this because there's no vaccine and there's no treatment. So we're not going to be truly safe from this until there's a vaccine. And then everybody needs to get the vaccine. I'm just pointing it out. You now know, as a population, the whole world sees how bad a virus can be. But I think what we're going to go back to is that once the peaks are down, there'll still be this virus. The flu doesn't go away. It stays out there and it comes back seasonally. And we have no idea about the seasonality of this. But you can't fight it until we have a vaccine or a treatment. So it will be a risk. But the vast majority of people who get this, with or without diabetes, will have a mild illness or a moderate illness. And for most people, unless you're older or have other health conditions, you're going to be fine. And in fact, I think what's going to be fascinating is in another couple of months, we'll be able to do a test where we can tell if you've had it, right? Because a quarter of people will have had it and not know. And in fact, this is only a slight joke, but I want everybody under 40 to, and then at the age of 40, just to get it and be done with it, right? Because if you've had it, you don't have to worry. In fact, if you've had it, just think, people will want to employ you because you can't get them sick. I'm a certified, COVID virus positive person. So to have had it isn't a bad thing because most of you all are going to be fine. It's older people with, other problems are going to be not so fine. So the reason we're preventing this is because we don't want people to die and we don't want to overwhelm the healthcare system, but it won't go away. So for the next year, people are going to have to say to themselves, like we did in the old days, we didn't used to have antibiotics. People used to be more careful about hand washing. People used to not hang out with somebody who was coughing. We want people to say, oh, gee, I am having a cough. I'll wear a mask to work today, or I'm not going into work today. So until we get a vaccine, this has to be in our brain, but I don't think it's going to paralyze us the way it is right now. I think we'll be able to go back out when they say it's okay. But my older patients, I'm going to keep them in a bubble for a year. I'm not joking. There are some people that they can go out, but I don't want them to be in a crowd. I may not want them to go to a movie theater. I would say for older people, rock concerts are out, but for younger people, it's not so scary if you think about it. But if you start looking at the news, it's like everybody's dropping over dead. So there's some balance here between, as an individual, what happens. But I do think that once we can test to see who's had it, it'll be interesting because more people will be immune. And once you're immune, we think that there's going to be at least a partial immunity, if not a full immunity going forward. So on some level, hope that you get it, that it's mild and you're done with it, because then you're done,
Yeah, absolutely. So did you say you think that test will be available within the next few months just to be able to see whether or not you've ever had it?
Yeah, I think because we can tell if you've ever had all sorts of things by measuring your blood. We can tell if you've had hepatitis. We can tell if you've, had all sorts of different kinds of viruses. We can tell if you're immune to pneumonia, if you're immune to whatever. But I know that they're working on that because it's important to know if you've had it because it puts you in a different category. It kind of is freeing, oddly. And like I said, I don't want anyone to get it, but if you happen to get it and it's mild, like I said, that's pretty good. It's fine.
Yeah, that would be great news to me. I would love to hear that I've already had it and that I'm now immune. And I know I would feel a lot safer just having that reassurance.
Oh yeah, you can go to the market. You can do anything you want. I wish I had it. You know what I mean? I want to, but I'm not going to go get it. Trust me. And I had a patient who came into the office and he had it, but I didn't know he had it because he didn't know he had it. And I put a Libre on his arm, a professional Libre to monitor his sugars. And I have 2 weeks worth of data with him on the Libre with the COVID-19. And he's an older gentleman, 75 with diabetes, all sorts of comorbidities. He should have done badly, but he didn't. He did fine in the end. And he sent us back the patch because now he knows he has it. And it was like, radioactive. We got it back. And I looked at it and I didn't get the disease, and he survived and did fine. So I now have tracings. And what happens to him, by the way, which is what happens to a lot of my patients, again, it's only been type 2s that I've seen with it, but you get kind of anorexic with it. You don't feel good. You've got a fever, your body hurts, and so you actually eat less. And that's why I keep stressing people need to have fluids at home. They need to you really encourage themselves to at least drink carbohydrates through it, because I've seen, you know, a number of cases and almost everybody just doesn't feel like eating very much. And with type 1, you've got to keep giving insulin and eating. But in general, my patients have done, at least in terms of their blood sugars, better than expected, not worse.
Well, there's some good news, I guess, at least.
Well, what can I tell you? I told you I'm always an optimist. But no, and like I said, my patients with type 1 diabetes have been really good about taking care of themselves. And it shows you that social distancing works, hand washing. I mean, people can do the right things and stay healthy. But your question about when do we get sprung out of our boxes is a really good one. But like I said, it's not going to go away. But I think that the high level of risk will go down. And, you know, we just have to be mindful of this. And older people will have to be more careful. I'm sorry, but that's just the way of the world.
Great. Well, thanks so much, Anne. We really appreciate it. Hopefully we'll be able to do this again soon. If not, you know, sooner, in another couple weeks.
Yep, I'm here.
Awesome. Thank you so much. Well, I'll talk to you soon. Bye.
All right, take care. Bye.